57-year-old Joseph Ndirango hails from Limuru and regularly visits Nairobi for medical treatment.
1996, I was diagnosed to be a diabetic person. So it came till 2013, thereabout. It made sugar level made my kidney fail. Also, I got hypertension.
Joseph is one among the 24 million Kenyans who rely on NHIF for affordable medical treatment. His treatment-seeking journey, however, he says has not been easy.
In October 2014, I did my very successful transplant. I stayed in India till January, almost January 2015. I came back. After transplant, my medication were costing almost 2,700 per day. The medication were very, very expensive. I thought NHIF would cover, because I was compliant with National Insurance Fund, I thought they would help me. Olewangu, they didn't.
On Wednesday, the 13th of May 2020, Joseph wrote a letter to the Principal Secretary in the Health Ministry, Susan Muchache, asking for medical and food aid. 12 days later, without any response, he wrote a letter to the Health Cabinet Secretary Mutahi Kagwe, explaining the same plight. This again went unanswered. The letter writing continued for a long time, only to receive a disappointing response 2 months later.
We needed facilitation, being given medications or help. But they said I can go to any hospital, I get the medicine, I talk with the hospital to waiver for me or do reduction. I request for reduction. Is it possible for an institution? Instead of for them writing to the institutions, they told me to go for waiver and price reduction.
Joseph spends about 40,000 shillings every month on treatment and is now seeking affordability of the same. On the other hand, ironically,
there is a cartel extending from NHIF to Kenya Medical Practitioners and Dentist Council.
Clinical officers are saddened by their oppression in providing such care to patients like Joseph.
NHIF is supposed to ensure that wherever you are, in the last village in this country, you have a hospital that has been declared so that Kenyans can be able to access these services.
Maafisa tabibu watakuwa wanaanza maandamano yao Alhamisi wiki hii hapa Nairobi, na tutakuwa tunatamatisha katika headquarter ya NHIF.
The fate of millions of Kenyans dependent on the National Hospital Insurance Fund for treatment facilitation remains unknown. And even as they continue to grapple with the situation, the relevant authorities remain silent. Ben Kirira, K24, Nairobi.